Hey, as you're well aware by now, beginning tomorrow, New York State will adopt the CDC's guidance on mask wearing and social distancing for vaccinated people. Those who are vaccinated will no longer need their masks outdoors and indoors in most cases. The state is following the CDC's recommendations for continued mask wearing in certain settings like healthcare and schools. Dr. Mathew Devine, the medical director at Highland Family Medicine, is live with us this morning. Doctor, good morning. Let's begin here with a thought about what's behind the CDC's thinking at this time as it relates to the updated guidance in masking.
Good morning, Mark. Great question. I think the CDC now has 6 months worth of data to review since we've been vaccinating the world, for that matter. And so I think this is really a culmination of some of the things that they've reviewed in regards to how it is that we can be together now that we have received the vaccination. So I think that's really what it's all about, is continuing to learn and evolve with the virus.
Some health officials do have concerns about this change at this time. What is their thinking?
Yeah, so I think the biggest thing behind our thinking is, how do you necessarily know who's been vaccinated and who has not? So it's essentially like an honor system. In theory, if everybody who was vaccinated could follow the CDC guidelines, but those who have not been vaccinated, or those who can't, remember there's still children under the age of 12, could be more potential for having exposures for the adults that are at high risk of still getting coronavirus.
Certainly reasonable concerns, Doctor. As we mentioned, New York State is adopting the CDC recommendations. That will happen beginning tomorrow. What was behind New York's decision? I know they took a few days to decide whether or not to get on board with the CDC. What did the governor have to say in that regard?
Right. I think every single state has to look at their what their certain policies have been to date, their vaccination rates of the state. And I think essentially the governor looked over all of the information, looked over the information of the state and said, hey, these are the benefits of getting vaccinated. And so therefore, looking at the information, they were able to share and offer the same offerings that the CDC guidelines is just recently published.
Hey, a final thought before we let you go. We know that in certain settings, public transportation, folks will still have to be masked regardless of their status. Healthcare facilities as well, settings as well, right, Doctor?
That's correct. I think we still, in the clinical settings, are still seeing individuals that have other illnesses and diseases for the very near and maybe long future will be still wearing masks and social distancing, especially in healthcare and long care facilities as well. And
we should mention you can add schools to that here in New York State as well. Hey, an important update, an important time in this pandemic. Great to spend a few minutes, Doctor. Thank you.
Thank you.
If you missed any of our conversation with Dr. Devine, we'll have it posted online coming up at rochesterfirst.com.